Hello everyone, my name is Dr. Ingita Bhardwaj. I am MBBS MS ENT and today I'll be discussing about nosebleed. So firstly I will be starting with the types of nosebleed. So basically there are two types of nosebleeds. One is anterior and another one is posterior. In anterior means in front. When the bleeding comes from the front of the nose, that is anterior nasal bleed. And in posterior, what happens is that bleeding, it goes to the backside, to the hind side. From the nose, it travels to the mouth. And bleeding occurs from mouth as well as from the nose. That is the posterior nasal bleed. The most common cause is trauma. Then in some patients, there can be history of nasal picking. Then hypertension. There are certain bleeding disorders which lead to nasal bleed. Then there are certain collagen vascular disorders which leads to nasal bleed. There can be some growth in the nasal cavity, like there can be some benign tumors like juvenile nasal angiofibroma, which can lead to nasal bleed. Then carcinomas can be there, like nasopharyngeal carcinomas are there, squamous cell carcinoma, adenocarcinoma. They also lead to nasal bleed. Firstly, we need to reassure the patient, and then secondly, we need to monitor their vitals. We need to take their pulse, BP, and see if all that is fine. Then what we can do is that in cases of anterior nasal bleed, we can put a little decongestive droplets we can put. For first aid, what we can do is that we can make the patient sit comfortably with the head head bent forwards, and we can just pinch the nose of the patient. Then this will help in stopping the nasal bleed. If that does not work, then what we can do is that we can apply a little decongestant cotton packets, and we can identify the bleeder if that is possible. And we can do nasal cauterization using agents like silver nitrate and phenol. If we can see the point of bleeding, we can apply that chemical cautery over there. Or else we can also use electric cauterization of the bleeding vessel can also be done. Electric cauterization of the nasal bleed can also be done. Then if we are unable to identify the bleeder and bleeding still continues, then what we can do is we can do an anterior nasal packing. In anterior nasal packing, we can either use ribbon gauze and pack the whole nasal cavity, or we can use Merosin to pack the nasal cavity. For posterior nasal bleed, what we need to do is we need to monitor the BP of the patient, and if bleeding is profuse, then we can go for posterior nasal packing. In posterior nasal packing, either we can use a nasopharyngeal pack which comes, or we can use a Foley's catheter to perform the posterior nasal packing, and then followed by anterior nasal packing.